Evening. Hello, everybody. We are living a dramatic situation. It's a weird time to be living in right now. So many situations and uncertainty we have never experienced before in our entire life. I do hope you are doing well and keeping positive through this. Let's be patient, loving. My head is racing with a list of things I should do in this time to distract myself from anything I'm feeling. Try to listen the lesson in all of this, but time will come when we are asked to talk about the lesson learned from this crisis. Our social welfare, our responsibility, behavior, the way we heed authorities' recommendations, how to fix the economy, and many other things. I would like to share with you a story who comes from a former colleague of mine. He carried out an interesting analysis of the COVID outbreak in Italy. He looked at Protezione Civile data and modeled three different scenarios, taking into account a method used in China to forecast COVID-19 spreading. There are good news. Number one, perhaps COVID-19 trend is changing, and we have many signals about the infection point. The increase of confirmed cases appear to be slowing down. The first scenario is about the current trend. The second scenario assumes the possibility to keep the decreased contagion rate around 10%. The third, optimistic but quite difficult scenario is about the possibility to keep the decreased contagion rate around 15%, like the last couple of days. In all three cases, the total number of contaminated people should happen around April 20th or April 10 or April 24th. Number two, the number of deceased people is slowing down, less than 1.25% every day. The disease rate is a bit complicated to compare with China models where this figure has been reached 4%, according to the accurate model conceived by a friend of my colleague in Shanghai. In Italy right now, the number of deceased people is about 9%, and it appears to be strange. It's likely a combination of the following things. The number of contaminated people is less than the real one. High percentage of aging people who is more likely to be attacked by the virus. Method adopted to distinguish the real cause of death, COVID-19, rather than other diseases. Number three, the number of people who recovered is around 2%. By making a combination of these three factors, we can see how many people tested positive we have and will have in the near future. According to the best prediction, we may have 0 contaminated people at the end of April. But it's more realistic to think that it will happen in the middle of May or at the very beginning of June. It depends on how people is keen to heed the crucial recommendation to stay home. The more we stay home now, the easier will be getting out in the near future, and make sure we are not obliged to stay home in case the COVID-19 will spread again. In addition, we have to assume that 6% of the people tested positive need undergoing treatment to intensive care unit. According to this percentage, we can imagine that in the worst scenario, the number of patients who need ICU, intensive care unit, treatment might be 4,500 or 5,000. If we consider the time frame in which is necessary for the patient to recover, we can come to the conclusion that April is going to be a very difficult month to manage, so we must stay home. Stop the virus spreading. This model is rather sensible because we are just at the very beginning, just a couple of days in the infection point in which the infection point is reached. The first model seems to be the most realistic. The third model is just an hope. All of them are based on citizen behavior and responsibility. Stay safe. Thank you for listening.